the maracas, I go chick, chicky, boom, chick, chicky, boom.
Welcome to No Laughing Matter with Cuba Pete, a show that takes a critical look at the disparities between medical school education and society's growing healthcare inequities. Join Dr. Pedro Cuba Pete Greer each episode as he interviews the experts working to transform medical education and ensuring that future doctors are trained to provide equitable and compassionate healthcare for all communities. Dr. Greer received the Presidential Medal of Freedom in 2009, honoring his dedication to providing health care to underserved populations. As Dean of Roseman University College of Medicine in Las Vegas, Dr. Greer is committed to creating a medical school of the future where students embrace the need to unite the heart and science of healthcare. And now, the host of No Laughing Matter with Cuba Pete, Dr. Pedro Cuba Pete Greer.
Live from Studio A in Las Vegas. Actually, live for us, but not for you. Hi, I'm Pedro Greer. I'm the founding dean at Roseman University College of Medicine. They also call me Joe, and today I'm Cuba Pete. Cuba Pete, No Laughing Matter, where we have incredible guests as we discuss different things of the intersection of society, healthcare, and education. Healthcare and how we have to change it to improve. Today, I have a spectacular individual who I consider a friend. Dr. Matthew Thacker is the program director for Advanced Educational General Dentistry residency program for the Roseman University College of Dentistry right here in Henderson. He's a Las Vegas native, as is his wife. Went to UNLV, got a bachelor's in Integrative Physiology, and graduated from UNLV's dental school in 2018. He is also a veteran of the Navy. Thank you for your service. He served 4 years as Fleet Marine Force dental officer on board the Marine Corps Air Ground Center in 29 Palms, California. But he continues to serve his country. Not only does he teach and take care of patients, he volunteers as a dentist for Special Olympics, Give Kids a Smile, UNLV's Sergeant Ferrin Veterans Clinic, Adopt a Pet, Project Homeless, and even our own Empowered program, which you've heard about before, which is a program that we have for opioid and stimulant use to pregnant women and recent mothers. His wife, Dr. Angelica Jane Bustos Thatcher, is also a dentist. And interestingly, they have 2 dogs, Puka and Boba. We'll talk about those later.
Oh, I look forward to it.
Matthew, why'd you go into dentistry?
That's a good question. Honestly, it's I like working with my hands. I always knew I wanted to do something that was going to be in the healthcare field, something that was going to be helping people. But I'm kind of selfish. I like seeing direct results to problems I can fix right there and mechanically. And dentistry is a very mechanical field. When we're replacing teeth, when we're replacing implants, we take a mechanical problem and offer a mechanical solution. And that's kind of the direction that I wanted to go. And
I read also you're an avid woodworker.
I am, yeah, I do. So I still got all 10 fingers for now. But yeah, I dabbled in it a little bit, and I really, it's a nice outlet. So
Your dedication to teaching and your dedication to serving the most vulnerable, where do you think that came from?
I mean, no matter what dental school you go to, dental schools are often tailored towards communities that are disadvantaged. And so you can't help but get a glimpse of that. And especially in Nevada, seeing the disparity, especially in adults who don't have access to dental care, I mean, it was kind of a no-brainer to me. Like you said, I mean, I was serving in the military, and I felt like I could do a better job of serving military members on the outside than I could on the inside. And, it's just hard to see it and not do anything about it, I feel like.
Well, I know that we're going to be doing a lot of stuff together, including seeing patients. And I know that already with the Empowered program. I mean, one of the important things of dental and oral care in patients that have a history of substance abuse or use disorders is it reduces the recidivism rate. It's also oral care is vitally important for what I consider the number one public health problem in this country, which is mental health.
Right.
Can you elaborate on that a little bit?
I can, yeah. So I mean, especially with these patients and patients in general who end up with conditions, it's more than just patients who have substance abuse disorder, but diabetic patients, cardiovascular disease patients. It leads to advanced bone loss, tooth loss, and at that point, even if they get their life around, they're able to go to a rehabilitation and stop using. If their teeth are missing, it keeps them from advancing with jobs, with relationships. Most of them can't do any kind of community or customer service jobs, and so not only does it affect their nutrition, their self-esteem, their ability to make a living, it affects more facets in life. And maybe I'm just biased because I'm a dentist, but it really seems to touch on every physiological and social, economical, and relationship factor in people's lives. And so it all kind of stems from that. And so if you're not able to solve that, it doesn't really matter if everything else has been fixed. It's hard to advance without having that smile.
You're with the Roseman University Dental Clinic, which offer the top care.
Correct.
And very interestingly, at the cheapest price.
That's right.
And you'll take any sort of even advanced oral health problems.
Yes.
And you actually train future dentists in that.
Right.
Last time I was at the dental clinic, well, the penultimate time was when you were having that fair before the schools.
Right.
And you had all the kids there. And it was a very joyous experience. Although thinking of going to the dentist is rarely a joyous experience.
That's right.
As a gastroenterologist, neither is visiting me, but the idea of doing that and the rewards that you see, not just in the kids, but in the poor parents that really couldn't afford to have gotten that dental care for their child. How does that make you feel?
I mean, it feels rewarding. At the same time, it's a small microcosm of what's really happening out in the community, and so it's kind of bittersweet. We're happy to help. Even if we had one patient there that day, it was absolutely worth it. But at the end of the day, we're just doing our small piece. What it ends up coming down to is a lot of change at the legislative level, in community outreach programs. So there's just a lot of work to be done. So it's rewarding, but that rewarding feeling kind of goes away quickly when you kind of realize that we're not done at all.
Nor will we ever be.
That's right. Well, hopefully we get close one day. But our program is designed. It's an advanced education in general dentistry, which is an optional residency for dentists who graduate and want to have a little bit more of an expanded function. Because unlike medicine, there is no limit to what a general dentist can expand into from a specialty point of view. And so, with these communities that are more rural or don't have access to care, being able to be a very comprehensively trained dentist, being able to do oral surgery, endodontics, root canals, dentures, everything in one, I mean, it really provides an excellent service to patients. And I truly believe that as much treatment that can be done by a general dentist is best done by a general dentist that's seeing you for your overall comprehensive care to begin with.
And you have one of the most innovative dental schools in the country. They have a 100% pass rate. But they just became the second dental school in the country that's a 3-year program. Right. And as opposed to the University Pacific, which is the other one, they only charge you 3 years.
Right.
So that's a 25% tuition cut, which leaves fewer students in debt. Although the dental school has almost 100% repayment rate. They get jobs right away because of how they're trained. And we'll have here in the future Dr. Frank LeCar, who is the dean of the dental school, which is based right now at South Jordan, Utah, although it's moving down here. Right. What would you say to anybody who wants to be a dentist?
I absolutely love being a dentist. I really do. I enjoy going to work every single day. I think it's an excellent field. I think it's very rewarding, as long as you can stomach, no pun intended, working in the mouth every day. But it's very rewarding seeing people not only get their confidence back, being able to. I mean, a lot of patients haven't even been able to eat properly in years, and being able to restore somebody's ability to eat, function, speak, communicate. Exactly. It's a wonderful experience. I absolutely love it.
So talk a little about what we're doing with you, myself, and Greg.
Yes. So with with medicine and with dentistry, there's often this chasm that's created. I truly believe it occurs back in pre-dental societies and pre-medical societies, pre-health societies, where you have this competitive nature of undergrad trying to get into your professional schools. And so with that, there's a lot of medical consequences. Dentistry has a lot of there's a lot of oral manifestations of most medical conditions, and vice versa. There's a lot of medical conditions that are caused by not having proper oral hygiene, like cardiovascular disease and
Or exacerbated.
absolutely. And so what happens is a lot of the times that communication, if it's not open, can lead to higher risk for procedures. If we don't know what medications the patient's taking, what they're being treated for. That being said, what we're doing is we're kind of combining forces where our medical and our dental services are offered under the same roof to really give patients a true comprehensive approach to their overall health care, which includes both of those. And so that's kind of what we're doing down in Henderson. It's something we're really looking forward to. I think it'll increase access to care for both patients, and I think it'll open up communication to provide safer care for patients. There's a lot of, people are working. People are out 9 to 5 and can't find time to come in to see the dentist or see their physician. And so having it all in one house, I think it's going to increase access to care comprehensively.
And we're also working together to be the clinical arm of an FQHC in the historic West Side. FQHC is a federally qualified health center that takes everybody. So the idea is, in our mission at Roseman, is we see people without prejudice. If you need our care, we're there. Tell me about your dogs.
Oh, absolutely. I was going to say we need that last line. We need to trademark that or something maybe before we publish this.
There we go.
So yeah, I have 2 dogs, Puka and Boba. One of them's a little Maltese, and the other one's a poodle. So I hate to say it, but the Maltese has got periodontal disease right now. So it is important to brush your dog's teeth, especially the smaller terriers. So yeah, they're a lot of fun. They keep us active, keep us moving.
How long have you been married?
We've been married for 3 years. We've been together for 10. We met in undergrad. I was her organic chemistry tutor, so yeah.
There you go. I've been married 42 years.
Oh, nice.
Yeah, somebody asked me what it was like. I said the first 41 are hell. But once you hit 42, it's a cruise. My wife doesn't like it when I say that. The idea of changing the delivery of care to serve all populations is something that I think should be part of every educational aspect of health sciences. To assume that we're doing well is ignoring the reality. If you were to teach or lecture at a medical school, what would you tell students?
To medical students. So I think one of the things that I would stress, and it's something that we are already doing in our interdisciplinary approach to teaching with our orthodontic clinic, with the pharmacy school, the nursing school, is at the end of the day, the patient needs to be seen as a person and not as, an organ system or a tooth. There's a person attached. I always tell my residents there's a person attached to the tooth, and you can't forget about it. And so oftentimes, the easiest approach to better bedside manner is just forgetting about the dentistry, forgetting about the medicine, and really trying to connect to your patient on a personal level. And so, what I would explain is just, at the end of the day, opening up lines of communication between all facets, all providers of patient care is only going to benefit you and benefit your patient.
I agree 100%. And underlining the importance of empathy, in other words, to listen to your patient. it becomes vitally important. It has been a real pleasure working with Matt. It really has been. Did you think about a career in academics?
Never. I really did not. I was in the process. I always loved education when I was an undergrad. I almost did PhD in organic chemistry, and thank God I didn't. No offense to Dr. Lee, my OChem old professor is watching this, but I'm really glad I didn't. What was the question again?
Did you ever think of going into academics?
Oh, yes. So I really enjoyed it. I got different tastes of it when I went to UNLV, and I really didn't. I saw a lot of the bureaucracy that occurred, and it stifled innovation and patient care. But once I started working at Roseman, I was blown away, and still to this day, after a year and a half, blown away at the way that we approach not only the clinical care but education in a way that puts the patient first. And I can't see myself working anyplace else. I love it. So,
well, it's sort of interesting. We recently had on here Dr. Pollard, who is the president of Nevada State University, and we talked about how higher education is a very toxic environment, especially professional schools. Right. And that's the beauty of Roseman, where there is no toxicity.
Right.
Or if it is, I haven't seen it.
Yeah.
It's collaboration. It's mission oriented. It might be because we don't have tenure.
Yeah,
absolutely. But it's also of the leadership, Renee Kaufman and Harry Rosenberg.
Absolutely.
And so, if you were to leave a message to our audience, what would you do?
Floss twice a day. No, I'm just kidding. I'm just kidding. I would say, like I kind of mentioned prior, is at the end of the day, the access to care for dentistry, especially for adults, and I say that in particular because a lot of Medicaid programs, different state Medicaid programs, children are covered 100%, but adults, they get extractions and dentures, even in teeth that could be easily restored. A lot of this change doesn't happen at the university level, at the patient level. It happens at the government level, and so make sure you're communicating with your legislators and really expressing and making your feelings known that dentistry is part of overall care, and it deserves to be treated as such.
And if somebody wants to see you or one of the other dentists, how do they do?
So if you give us a call, we have 2 clinic locations, one in Summerlin, one in Henderson. Our phone number is 702-968-5222. You give us a call, make an appointment, or come on down, stop by, and we'll be happy to make an appointment, especially towards the end of the year when we start having the medical clinic open up down in Henderson. I think it'll be a good opportunity to make both appointments.
Then we referred quite a number of patients to dentistry.
Yes.
Because it's important. The oral health is important for many different reasons. With the empowered group, because it reduces recidivism. With mental health, because it improves confidence. For EAT, it's essential. For employment, it becomes very important. Without good oral health, you're going to have bad health overall. And so, Matthew, thank you for all that stuff you do.
Absolutely, thank you.
And take care of your dog's teeth, for God's sakes.
I'm trying.
With that, this is Cuba Pete from Studio A in Las Vegas saying, Dr. Thacker, thank you.
Thank you. Thanks for having me.
And I look forward to what we can do in Las Vegas and all of Nevada.
It's going to be fun.
It's going to be a lot of fun.
Yeah.
And so, thank you very much for being on here, my friend.
I appreciate it.
You got it, buddy.
If you enjoyed today's podcast, please subscribe, like, and comment on your favorite podcast platform. If you'd like to support the groundbreaking work that Dr. Greer is doing at the Roseman University College of Medicine, please donate at the link below. Thanks for tuning in to No Laughing Matter with Cuba Pete, as together we work to unite the heart and science of healthcare to serve all in our communities. See you next time.